anybody if they live long enough. So it's one of the few things in medicine that has a 100% rate, that if you live long enough, you're going to deal with some of these issues. And the reason I wanted to kind of talk about this is because for many years, even 15, 20 years ago, the options you had for dealing with these issues were you either take some pills, if it's bad enough, you get surgery, and after that, that's pretty much it. There's no other options. But alhamdulillah, today, we're in a place where we have a lot more options. All these pictures that you see today, just aside, these are all things that I did. So this, these are all my personal pictures on patients that I've worked on. So these are all things that I do. So I see how they work, I see what doesn't work. And inshallah, you can learn about it. Everybody knows family members that are dealing with stuff like this, our parents, our relatives, friends, and it can be something that, inshallah, Allah put barakah and benefit in it. To start off, Allah subhanahu wa ta'ala says in Surah Al-Rum, Allahu alladhi khalaqakum min da'fin thumma ja'ala min ba'di da'fin quwwah, right? So Allah subhanahu wa ta'ala says that He created us from weakness. And then after weakness, He gives us strength. And we all know that it's when we're young, and you can even see in this little picture here, I have a son, he's 2 years old, my daughter is 6. Weakness is what defines them. They can't do anything without you, right? ثُمَّ جَعْلَ مِن بَعْدِ ضَعْفٍ قُوَّةٍ. And after weakness, you have this period of strength. When you're 15, 20, 25, 30 years old, you feel like you're invincible. And this is physically talking, but also mentally. Today we're going to talk more so about physical. And then ثُمَّ جَعْلَ مِن بَعْدِ قُوَّةٍ ضَعْفًا وَشَيْبًا. And then after you have that period of strength, Allah subhanahu wa ta'ala puts you back into weakness, وَشَيْبًا, and white hair, old age, right? يَخْلُقُ مَا يَشَاءُ. Allah subhanahu wa ta'ala creates whatever He wills, وَهُوَ الْعَلِيمُ الْقَدِيرُ. And He is the all-knowing and all-able. And He has power over all things. So just something to think of as we do this. Alhamdulillah, we've all been blessed with Islam. We talk about these things, but you'll see as we start talking about, the next thing we're going to talk about is arthritis. A lot of these are things that if you live long enough, you're going to face. Because our bodies, our bones, as Shaykh was saying, they were never meant to last us forever. Because this dunya is not forever. As Shaykh said after the salah, ثُمَّ أَنشَأْنَاهُ خَلْقًا آخَرَ. That was the next ayah, what Shaykh said, that He put flesh on your bones, ثُمَّ أَنشَأْنَاهُ خَلْقًا آخَرَ. And then after that, He's going to bring you back again. So this body that we have is a reminder for us that it's not meant to be forever. It's very temporary. If you live long enough, it's going to start to break down. Just like if you have a car, you drive it for 15, 20 years, it's going to start to break down, and no one is surprised because the car wasn't meant to be there forever. Our bodies are the same way, and that's a reminder for us that we do these things, but at the end of the day, we're all going back to Allah subhanahu wa ta'ala. The soul is what's permanent, and that's what needs a lot of work. So with that, a little bit about me. Alhamdulillah, a lot of you here know me already. What I do right now, I'm an interventional pain management doctor. What that means is I work in a group with 3 doctors. It's me and 2 other doctors. The other 2 are orthopedic surgeons. They specialize mainly in spine surgery, but they do other things as well. And then there's me. So where I come in is I do everything from just doing medications and physical therapy to until you need actual open surgery where they cut you open, give you a new joint, do thing. In between that, there's a lot more. Both, and it kind of varies in how invasive it gets, and we'll talk about that. But that's kind of all the stuff that I do. I went to Stony Brook for undergrad, 2013. In 2017, I graduated from med school. That's, alhamdulillah, when I started coming here, so a lot of you know me since then. And then I did my residency in anesthesia in Brooklyn. And then just this year, alhamdulillah, finally after a long, you can do the math, however many years I finished, and now I work in the group. I'm in Westbury 3 days. I have a place in East Meadow, and then one time in Elmhurst. And for all my procedures, I use the operating room in St. Joe's and Plainview Hospital for now. So what we talked about, a lot of what we talk about today is going to come down to this word, right? Arthritis. And I think everybody that has any kind of pain and you seek any kind of treatment for it, you've been told that you have arthritis. And it's a very broad term. What arthritis essentially means is in every single joint we have cartilage. And what cartilage is it's just padding for the joints. That's what keeps it nice. That's what keeps it healthy. Like we gave the example of the car, you drive a car for 15, 20 years, it starts to break down. Our body is the same way, right? So after 50, 60, 70 years, depending on your lifestyle, your weight, your genetics, your joints will start to break down. And once they start breaking down, that's when you're going to start feeling that pain. For some people, this can happen earlier. Some people, it can happen later, but it's eventually going to happen. And you can see there's a stat. Over 65 years old, 90% of individuals will have some form of arthritis somewhere. The pain of it, everybody's familiar with. It's the leading cause of disability in America and probably the world. And it does happen earlier in women, so something to keep in mind for our mothers and our sisters. Another thing for if there's any young guys in here, if you have old injuries, so if you're young and you play a lot of sports and you did something to your shoulder, to your knee, when you're young, it goes away. Maybe at most after a month, you don't feel it anymore. But a lot of the times, 20, 30 years pass, and a lot of our elders can kind of attest to this. These old injuries you had 30, 40 years ago, they start hurting again, because anytime you injure a body part, the arthritis comes there quicker. So if something was going to happen when you're 70 years old, now it can happen 60, 55, depending on how severe that was. So something to keep in mind. One thing that we're going to talk about today a lot is also the importance of exercise. So almost everything that I'm talking about, everything that can be prevented, can be treated, is exercise is going to be a huge part of it. It can impact you not ever having to deal with these issues. If you have some of these issues, it can be what kind of helps you avoid some of the things like surgery and these kinds of things. And it's also, whether a lot of us realize it or not, it's a huge part of our deen. Our Prophet ﷺ, he was known to be a very fit person, right? Even into his old age. You think about all these battles, there are so many narrations talking about the Prophet ﷺ, he would be the most fierce in battle. And he would be a man in his 50s, you know, he died in his 60s, and he fought right up until then, right? He received nubuwah when he was 40. So he was a 45, 50, 55-year-old man in the battlefield, swinging a sword, riding horses. You need to be very fit to be able to deal with these things, right? And there's narrations that talked about how he looked, sallallahu alaihi wasallam, that his belly never popped out, right? He was never an overweight. He was never a heavy person. He was always very fit. And similarly, even for a lot of us, we'll see that the older generation from back home, like I'll share a personal story. My grandfather still lives in the village in Bangladesh. And he still, takes care of his farm. He still has his animals. And nobody really knows how old anybody is back home, but he's probably over 80, at least 85, right? And he had 12 children, mashallah. And all of his kids moved out of the village and they moved to the city. So they lost that lifestyle. They all became sedentary. They stopped exercising as much because they don't need to work on the farm anymore. And physically, he is healthier than all of his children. May Allah subhanahu wa ta'ala preserve him. But that's something you realize, that once we let go of what is in our natural tendency of exercising, maintaining a healthy weight, eating right, then these problems will get worse, and they do tend to occur. So this is something that we're going to talk about a lot. Also, just weight in general. Anytime you're heavier, that's more stress on your muscles. That's more stress on your joints, right? Your legs have to carry you around all day. Your knees have to carry you around all day. If you're overweight, then if you think about that over a period of a lifetime, for 50 years, 60 years, your knees have been carrying that extra weight all these years. So of course your knee is going to have issues. Of course your shoulders are going to have issues. These are things to be very mindful of. Taking care of these things early on and not getting into this will prevent you needing most, if not all of these things. If you go see a doctor for a lot of these things, they will tell you start off with medications, PT, exercise. We're just going to talk about this really quick. PT and exercise, a lot of people think that this is going to fix what I want, because we go to the doctor, we either want a shot, we want a pill, we want everything to go away, but that's really not the best way to do it. The best way to do it is exercise and PT, right? If you have issues with a particular joint, strengthening the muscles around that joint will help that joint get better to some extent, right? Kind of going back to what we spoke about in the last slide. For medications, we'll go really quick. Tylenol, and it's actually a very good medication, even though it's over the counter. The max dose, just everybody keep in mind, is 3,000 milligrams. So if you have 500 milligram pills, you can only take 6 of those without hurting your liver. NSAIDs, things like Motrin, Aleve, naproxen. A lot of people take these because they're available without a prescription. But you actually can get into a lot of trouble with that because people take them thinking that, oh, this is something that I can buy without a prescription, it can't hurt. But if you take too much Motrin, too much Aleve, too much naproxen, if you start mixing things together, I've seen patients end up on dialysis from just taking Motrin too much. They're also blood thinners. So if you're on a blood thinner for other conditions, these will thin out your blood even more. So that can be very dangerous. They can give you stomach ulcers. So the point of this is even though you can get these medications without a prescription, they're not benign medications. It's not that you can just take them however you want. Muscle relaxers, something we prescribe all the time. They can be sedating. Nerve pain medications, a lot of, sometimes I prescribe, can also be sedating. They can also take a little bit of time to work. So for these medications, they're not like things that you take like a Tylenol. You have pain, you take it. You have to take it every single day for it to actually work for you. And it takes about 2 weeks for it to build up in your blood for it to actually work. And then also, and lastly, opioids. They've been on the news a lot past couple of years. Oxycodone, Percocet, these kinds of things. They're almost never indicated for this kind of pain. There used to be a time when these were overprescribed because there's a lot of politics behind it, a lot of issues behind it. But essentially, they're very addicting medications. They will take your pain away, but they're not doing anything for why you're actually having the pain. And what happens is over time, your body is going to need more and more. So if you take oxycodone 5 milligrams, after a while, you'll need 10 milligrams to get you what the 5 milligram got you. And then you'll need 15, 20, 25. And that's how people get addicted to these things. And the bad thing is, even though your body will get used to the pain relief of it, your body never gets used to the side effects. And the side effects are, it stops you from breathing, people overdose on these drugs, people die from these drugs. So that's something to keep in mind. I personally will never start these medications on somebody unless they're post-surgery or it's like a very short script for something severe, like you break your leg or something like that. In general, nobody should be on these medications for arthritic type pain. Just something to keep in mind for yourselves, your relatives, and all that. So this is what arthritis looks like. So when we're talking about joints, the main 3 joints that are affected are your knees, your hips, and your shoulder, right? So if you see on the left of all these is a normal X-ray. So this is somebody's shoulder. It's nice and clean. There's there's nothing, nice joint space here. And then you can see somebody with arthritis, that whole thing disappears. Same thing with the knees. Over here, the knees, nothing's touching anything. Nice open joint space. And then over here, you can see there's a clear difference. Even if you don't look at these, you can appreciate. And this, you can just, and this is a hip, same thing. This is a new hip and probably a very young person. And as we get old, as we started off in the beginning, as Sheikh said, your body isn't meant to last forever. Over time, it will start to look like this. Some people worse than others, but this is really, for your joints, this is what's causing most of the pain. So the first line treatment, people will tell you, try PT, do this, do that. The first line is usually a steroid injection. This is something that I do I do at least a couple of these every single day that I go to work. It gives you about, on average, a steroid injection into a joint will give you about 3 to 4 months of relief, okay? But that depends on how bad the actual joint is. If your arthritis is severe, it's gonna give you significantly less than that, right? And the way the steroid works is by reducing the inflammation. In this day and age, if you go to a doctor and they're not doing injections using imaging, then you should find somebody else, because every single injection should be image guided. Like these, like I said, this is something that I did sometime last year. You can be sure that the medication is going where it needs to go, and that way you're not leaving anything to chance. 15, 20 years ago, people used to just put a needle in your knee and inject it and kind of take it by chance. But in this day and age, either X-ray or ultrasound, it should always be done with imaging. So whether you have relatives or you're getting these yourself, just make sure that it's always something that's being used. The bad thing about steroids, they do have a lot of side effects, right? So if you have a steroid injection, your blood sugar is going to go up for 4 to 5 days afterwards. If you don't have diabetes, that's not an issue. But if you have uncontrolled diabetes, that can be a reason that you can't get this. It also is going to raise your blood pressure, same thing. It comes down by itself. It's going to lower your immune system. So if you have things like transplants or things like that, it's something to keep in mind. And then there's other rare side effects. But this is usually where we start. One bad thing about steroids is the steroid itself, even though it helps you feel better, it actually makes the arthritis worse over time. So the same thing that's helping you over time, you keep getting them every 3-4 months, a couple of years pass, And what's happening is the steroid isn't working anymore. The reason it's not working anymore is because the steroid itself breaks down your joint even more. So it's not a benign thing. So for me, when I have young patients come to me, I actually try to not do this because it's going to make it worse. If you're older, 50s, 60s, and you're headed towards a knee replacement anyway, which we'll talk about, then it's not a big deal. But in younger people, it's something that I do consider. But the good thing about steroids is it'll almost work. If you've never had one before, it'll almost always work. It'll give you at least a couple of months of relief. Once the steroids stop working, or sometimes before, we do gel injections. This is me doing a gel injection in somebody, but it's what the gel does is whatever wore away from the cartilage, whatever padding you lost in your knee, like we saw it in that X-ray, it's trying to put some of that back. But of course, whatever we put back is not going to be like what Allah subhanahu wa ta'ala made in the first place, right? We can't ever replicate that. So this is going to get you about 6 months, then you're going to need it again. It's usually a series of 3, so you have to go back to your doctor 3 times to get 3 injections back to back to back. Some companies do it as a one shot, but I find that it works better with 3. And it has minimal side effects, so no blood sugar issues, no blood pressure issues. The cons of this is, again, you have to come back 3 times, and it's not covered by all insurances. Unfortunately, in this country, a lot of what we do is dictated by insurance companies. So even if we think it's the right thing, if the insurance company doesn't cover it, then it you just can't get it. So it's sad, but it's the reality. And most insurances, they won't cover this until you get a steroid shot. And the steroid shot doesn't work, then you can justify it. And some insurance companies, like off the top of my head, like Health First, Fidelis, a lot of the Medicaid insurances just won't ever cover this. You can pay cash for this too. Like, in our office, they charge $150 per shot. And that's about the average at most. So for 3 shots, it would be like $450. That's $450, not $4.50. But that's kind of what most places will charge out of pocket for that. And then finally, some of you may have looked into this, is PRP injections. It stands for platelet-rich plasma. These are never covered by insurances because they're still considered experimental. So they're very expensive. I don't do this because I just don't believe in experimental things. But what it essentially does is it takes your own blood, they spin it through a centrifuge, so you have increased concentration of platelets, which are believed to actually help the joint, and they inject that into your joint instead. So some people say it helps a lot, some say it doesn't, but the reality is it's still inconclusive. So you're not gonna get insurance to pay for this. If you pay for it, it is very expensive. So I have people. This thing isn't working anymore. Brother Bubble? Oh, it's good, okay. Well, I think this cable is okay. So I have people come to me all the time and ask me about this because they don't want to get a knee replacement, they don't want surgery, and they say, should I try this? And in general, I actually say you shouldn't, because this thing is going to cost you anywhere from like $1,500, $1,000 to $1,500, and it may not even work, right? So whereas a knee replacement, like we'll talk about, is something that's always going to work. It's not going to, it's curative. So let's talk about that. Is it disconnected there? Okay, I think it's just this. Okay. To finish off, joint replacement surgery, a lot of people have questions about this. Okay. If you get to a point where the gel injections aren't working, you try steroids, it's not working, you still have bad arthritis. One thing to keep in mind is the arthritis never goes away in your joints, okay? Whether you do gel, whether you do PRP, whether you do steroid, the arthritis is still going to be there. The only thing that's going to cure the arthritis in your joints is by getting you a brand new joint. And alhamdulillah, we live in a time when this is done all the time. There's more than 1 million joint replacements performed just in America alone every year. It's one of the most common surgeries. And what it essentially does is, this is a picture of a knee replacement. They cut off the part of your knee with the arthritis and they replace it with metal. So now you have a brand new knee, right? It does require a little bit of rehab afterwards, but in general, they're very safe surgery. It is major surgery. I don't want to downplay that, but they're very successful surgeries. People have been doing this for a very long time now, and they've gotten down to a very exact science. My mom personally got this a couple of years ago. Once you get this, it's the closest thing you'll get to a brand new knee. Of course, like we said, it's not going to be exactly like the knee Allah subhanahu wa ta'ala gave you when you were born, but it's close enough where you can be very comfortable with it. A lot of people ask me, because a lot of people get to this point and then they stop, because our community in general, for good reasons, for bad reasons, they don't like surgery. You know, they don't like the concept of somebody opening your knee and sawing something off and giving a new metal knee. But I will say that in almost everybody, if this is an option for you, you should get this, because 2 in 100 will have a major complication. That's 2%. So nothing is 100%, but this is pretty close, right? And it can potentially solve all these issues that you're having with your knee pain. The rehab can be tough. It's a couple of weeks, a month. You may have to pray in a chair. You may not be able to flex your knee, but if you work hard on the rehab, this is an excellent option. And there are very few reasons to not get this. And we'll kind of go into that. But this is just a knee. Same thing could be said for like a hip replacement. People get that all the time as well. And then shoulder is much less common, but that is done. But knee and hip are very routinely performed. And if that's something that you feel like you need, you should definitely explore it. Talk to multiple surgeons. And if you've tried kind of everything that we've talked about, this may be the next step for you. One thing to remember is these things, they don't last very long. They last for about, nowadays, 20 to 30 years is how long the artificial joint lasts. So if one of the things they'll say is if you're 40, 50 years old and you get a knee replacement, nowadays with how people live, when you're 70, the joint's going to expire. You're going to need a new one. And that second surgery is not recommended. So a lot of the times I work with surgeons, what they'll do is if somebody has this, we'll try to do some of the things that we talked about to get you to at least 60 years old, 65 years old, and then they'll do this replacement. So that way, you know, probably for the rest of your life, you don't need another knee surgery. This one will last you. Or hip, the same thing can be said. But then there's people that can't get surgery, right? There's people that can't get surgery because they have really bad health conditions, diabetes or heart disease, whatever it is. They're not good candidates. There's people that get surgery but still have pain. It does happen, and the reasons sometimes aren't that clear. And then there's people that don't want surgery. I put a star next to this because I think this, like if you're a good candidate for a joint replacement and it's bothering you that much, you should really consider just getting the joint replacement. But for the first two categories, those people come back to me, right? So at that point, what I can do is I can't really do injections anymore because injections at that point don't work anymore. If you've already had a surgery or you can't undergo surgery, that doesn't work anymore. So at that point, what I do is the nerves that innervate the joints, so the nerves that carry pain from the joints, I burn those nerves essentially. So this is like when I did this a couple of weeks ago, there's these groups of nerves that go near the joint. First, you do a block to see if it was something that worked for you. I mean, the details of that don't really matter, but essentially, I go there, and these are special needles that I hook up to a machine, this kind of machine here. The machines heat up, and it burns away the nerves completely. Once you burn away those nerves, it usually lasts for 6 months to a year. And what happens after 6 months to a year is those nerves grow back. And once the nerves grow back, you can come back, I take you to the operating room again, and we do it again. And we can kind of do this indefinitely. The first part, usually I do without anesthesia, and the second part is just light anesthesia. You don't really need to go to like, it's not like general anesthesia for surgery or anything. This is a great option for somebody if this is something that not, at least in my experience, people don't know about. So if you're somebody that can't get surgery for whatever reason, if you're somebody that's had surgery but still has pain, which does happen, this is an option for you. This is covered by most insurances. Some you may have to fight for, but this is an option for you. And it's low risk enough that it's at least worth trying. So this is something to know about. It can be done for the knee. It can be done for the hip. This is one for the hip. It can be done for the shoulder. But keep in mind that what you're doing here is you're not taking away the arthritis, you're just kind of taking away how you feel it. So the nerve that brings the pain, you're just knocking out that nerve. So the arthritis is still there, I'm just knocking out the nerve so you don't feel it. So again, even like when you say it like that, if the other option, if you're a candidate for surgery, surgery is definitely the better option than this, okay? That's kind of just an overview of joint pain. We can take some questions at the end. We're moving on. neck pain, right? So we're going to talk about neck and we're going to talk about back. Those are the two most common things. Neck pain and back pain are essentially, when we speak about it, it's the same thing because your neck and back are part of one structure, right? You have these bones, they go all the way down, your spine goes all the way down, but we can still separate it like this. The most common is you have muscular pain, you sleep wrong one day, or you do something, you shovel snow, whatever it is, and you get to spasming, stiffness. You can take some muscle relaxers, medications, rest, and it'll go away in a few days. Sometimes that doesn't happen, right? Sometimes you have arthritis in these little joints that you see here. Once you have these arthritis in these little joints, same thing with the knee and the hip, it's not going away. But we're not at a time yet where, so the knee is easy. You just cut out the knee and give somebody a new knee. Nobody's going to give you a new neck. It's not something that can be done yet. So we have to find ways around that, right? So if you look at this X-ray, this is somebody's neck, and same thing. A lot of arthritis up and down the neck. Pain from this is going to be when you have pain in your neck, sometimes your shoulders. When you twist and turn, you have a lot of pain. It's kind of stiff all day, especially in the morning. And the other kind of neck pain is what we call radicular pain. What that is when the arthritis starts pressing on these nerves. And the way these nerves work is these nerves go into your hands and your arms. So a lot of the time people will have neck pain and they'll say it's shooting down my arm. And that's what this is from, right? And that's kind of how we classify any kind of back pain. Is it axial or is it radicular? Axial, it stays in the neck or stays in the back. Radicular, same thing. It goes onto the legs and goes onto the feet. For back, it gets a little bit more complicated, but the general idea is the same. Does it stay in your back or does it go into your legs? Because if it's going into the legs, that means now it's a nerve issue. If it's staying in your back, then it's a whole separate set of treatments. The most common cause of back pain that's not muscular is bulging discs, herniated discs. We're all kind of familiar with these terms. And what that essentially happens is this is your back, this is your spinal cord. And like we said, these nerves, they come out of your back and your neck, and this is going to go down your arm, your shoulder, your legs. That's how kind of the anatomy is. So once this disc is soft, it's like jelly. So sometimes it can come out or bulge. Once it comes out like this, it can press on that nerve, and now this whole place where that nerve goes is going to hurt, right? So this nerve can go all the way down your leg, and now everywhere that nerve goes is going to burn, it's going to hurt. That's going to be the issue that you deal with. And based on exactly the pattern, we can narrow it down to exactly which nerve it is. So that's where this is probably the most common thing I do is epidural injections. These are all things that I've done. I think these are all within like the past 2 weeks. These three cases. So what we essentially do here is where this problem is happening, where that disc is pressing on the nerve, we get a needle there. We do it under imaging guidance, and we put steroid there. And putting steroid there takes care of the inflammation and should get you at least 3 to 4 months of relief. If you're a younger patient, because this is something that can happen in like 20, 30-year-olds, car accidents, kids get hurt in the gym, that kind of thing. I also do it for them. For them, it can be just a one-time injection. But for older people where there's a little bit more degeneration going on, it can give you 3 to 4 months. It gives you 3 to 4 months, you come back, you get another one. You can kind of go on like this forever, as long as it keeps working. Unless you have frank weakness, like you can't walk, you can't feel your legs, you can't feel yourself going to the bathroom, unless you have things like that, nobody should be rushing you to do surgery, okay? You should at least try 1 or 2 of these injections first. You can see like in this one and this one, for example, this person already had surgery. So this person already had surgery. These are screws in the back, right? But even after the surgery, the fact that I'm doing this for them means that their pain didn't go away. So back surgery, we'll talk about for a little bit. It's very extensive surgery. So you should at least try some of these things first before you commit yourself to a big surgery like that. Yeah, so these are just some epidurals, someone's back, this is somebody's neck. Anytime you have that kind of pain in your neck going down your arm, this is something that you're a candidate for, and you should definitely get it, barring any other issues. If the pain just stays in your back and it's not going anywhere else, so that's kind of more so the arthritis, we do the same thing that we talked about for the knee, right? So in the knee, we were burning the nerves in the knee. For the back and the neck, we can burn the nerves there. The nerves that kind of get the pain from those arthritic joints. So this lasts for 6 months to a year. It's a bit of a process doing it. We do it in the operating room. That's me doing one a couple of weeks ago. But it's usually 6 needles, 3 on each side, and we just burn the nerves that are carrying pain from those joints. And once we burn those nerves, for 6 months to a year, the nerves aren't going to grow back. They grow back. We do it again, and that's an option that works great for some people. There's a lot more to be said about the back, but it's beyond, I'm not going to go through every single thing that I do, because the point of this is to just know that there are a lot of options out there, right? It's not just I deal with this or I get huge open fusion surgery, right? These are all things that I do in my practice, and you may be a candidate or you may not be a candidate depending on exactly on your MRI, your symptoms, but everything that's listed here, these are all same-day procedures. You go to the operating room, you come out that afternoon. Recovery is minimal, a couple of days to not even that. And if it's done in the right person, it does work, okay? And again, the point of all this is, one thing I don't want to happen, that does happen unfortunately, is people kind of get told that, oh, you have to have surgery, that's it. Unless you have emergency symptoms or you can't feel your leg, you can't move your leg, that's just not true. You should be trying some of these other things first. And also, if you've had surgery and your symptoms aren't getting better, you can still be a candidate for a lot of these things that we do. This is the last thing. This is kind of seen as a last resort. Okay, so what this is it's called spinal cord stimulation. This is usually done in people that have had surgery already. They've had rod screws in their back, but their pain hasn't gone away. And it's actually very humbling, because it kind of shows you, with everything we know and everything we know how something is supposed to be a certain way, things still don't work, right? And Allah subhanahu wa ta'ala tells us in the Quran, وَمَا أُوتِيتُم مِّنَ الْعِلْمِ إِلَّا قَلِيلًا, right? That you've only been given very little knowledge, right? So sometimes we'll see an MRI, we'll see what the problem is. They'll either do surgery, they'll do this, they'll do that. We'll do everything by the textbook. Everything looks perfect. Imaging looks perfect. And the patient still has the same exact pain, right? And nobody can figure out exactly what happened. And that's when you have to kind of chalk it up as, I don't know. We don't know everything. For those kinds of patients is where this comes in. This is called spinal cord stimulation. So very quickly, how pain works is you feel pain somewhere. The nerves in the periphery, so the nerves in your leg, your back, wherever, it carries that signal to your spinal cord. And then your spinal cord takes that pain signal to your brain. And that's how you actually feel the pain. What spinal cord stimulation is I put 2 electrical leads right up by the spinal cord. So this is the patient that I did, but these little black dots right here, these are actually electrical wires, and I put it right next to the spinal cord. And what these electrical wires are doing is, when pain is coming in, the pain signal is coming in, before it can get to the spinal cord and make it to the brain, it intercepts that signal. So then your brain can't really perceive it as pain anymore. That's kind of, it's obviously, it gets a lot more complicated than that, but that's kind of the gist of it. It's done as a last resort thing. In people that there really is no other option, but they're still suffering, that's when we do it. We usually do, not usually, we always do a trial. So a trial is, I put this in your back, I kind of tape it up to the skin, kind of, actually no, this is an implant, but this is one I did a couple of months ago, but I tape it up and you try it for a week. And then for 1 week, you see how you feel, how you like it. If it works for that 1 week, then I take it out, and then you get the permanent implant. The permanent implant looks like a pacemaker, but it's on your back, and that's something that you live with. If you try it for a week and it doesn't work for you, we take it out, and it's like it never happened. Again, it's something that people don't always realize is an option. But for people that have kind of been through the ringer with all these procedures, all these surgeries, it is something that you should definitely ask about, and it's probably something that you're a candidate for. Insurances do pay for this pretty much across the board, because it's been being done for a while now, and it's accepted that this is something that can be beneficial for people. And then finally, just very quickly, I'm not a spine surgeon, but I work very closely with them. Sometimes you just need surgery, even after everything we talked about. Emergency situations, you can't feel your legs, you're having incontinence, things like that, paralysis, then you definitely need surgery. Nowadays, surgery isn't just this. This is kind of what people think of when they hear back surgery, where they put in screws and rods and all these things. This is still done pretty commonly, but only if you really need it. Now they have robotic, endoscopic surgery that the guys in my practice do. They have minimally invasive things. So one thing that I kind of want to take away from this is if somebody tells you that you do need surgery and you've tried everything, talk to at least 2 people in terms of surgeons. See what your options are, see who's going to do the more minimally invasive thing. So, because sometimes what happens, and it's unfortunate, is not every doctor, and even for what I do, not every doctor will offer everything, right? But either sometimes they don't know it exists or they never ever trained in it. And they won't necessarily tell you that, hey, I don't know how to do this, but so-and-so does, go to this person. Because they really don't have any incentive in telling you that. You know, obviously in a perfect world, everybody would do that, but unfortunately that's not how the real world works, right? So if you come to me and, you know, there's something that I don't do, I don't want to lose you as a patient, so I'm not going to tell you that somebody down the street can do this. That's unfortunately how a lot of healthcare in general operates. So just make sure that you've kind of talked to at least 2 people. Almost all insurances for major surgery will cover a second opinion. So if you go to talk to somebody else, they won't tell you that, oh, we're not going to pay for this. They have to pay for it. That's something that everybody should know. No matter what the insurance is, for major surgery, the second opinion is going to be covered. So make sure you take advantage of that if somebody tells you that you need something like this. So we're pretty much done. The key points here, we kind of started off talking about exercise. It's a part of our deen. It's a part of how we were taught to live by the Prophet sallallahu alaihi wasallam. Take it seriously. You know, weight loss, maintaining a healthy weight will keep 90% of these things away from you. That it's the root cause of a lot of these things. Sedentary lifestyle, it's antithetical to the Sunnah lifestyle, right? The Sunnah lifestyle is something it's not sedentary. We're supposed to be up and moving. And that will also keep a lot of these things from not applying to you. Last thing, surgery. Like I said, especially for the joint replacement, knee replacement, hip replacement, sometimes, a lot of the times, it is the best option. It is something we've been doing for a long time. And it is major surgery, but 98% of the time, that's the exact statistic, it'll go fine. And the other 2%, you know, nothing is 100%. And finally, know all your options, right? If you're dealing with these issues, you may not necessarily have to deal with them. Sometimes whoever you're seeing, they might not know about some of these things. If you're not seeing a specialist, then they might not know they exist. They might not know who to refer you to. But just have an idea that there are a lot of things out there when it comes to pain and managing a lot of these issues. It's kind of why I went into this field myself, because pain can be debilitating. Like a lot of the times, medical students or whoever will ask me why I do this. It's somebody can have bad diabetes, heart disease. It won't stop them from coming to the masjid. They'll still do it. Like somebody can be sitting here with 500 hopefully not, but like 300 blood sugar. It still doesn't stop you from doing what you like doing. But if somebody has bad pain, they're not coming to the masjid, right? It can stop you from doing the things that you like. So address these issues. Don't just accept that this is me from now on and I'm just going to be in pain for the rest of my life. Because most of the times that's actually not true. Sometimes you may have to push a bit for that, but it'll be worth it, inshallah. And we'll end with this. Alhamdulillah, we have such a rich tradition that even something like this that sees that it's so far away from, you know, like everything ties back to our deen. We started off with the ayah that Allah subhanahu wa ta'ala created us, and we go through weakness, then we have strength, then we have weakness again. And we'll end with this, that the Prophet sallallahu alaihi wasallam said that when it comes to pain, any fatigue, disease, even the prick of a thorn that you feel, keep in mind that every single suffering you have, Allah subhanahu wa ta'ala is taking away your sins for that, because that is the beauty of our religion, right? So whether you go through some of these things or not, whether it works for you or not, keep what we said in the beginning, what Shaykh said, that this body is temporary, and all the time, these issues that we deal with it can be a means to elevate our status in the hereafter. May Allah subhanahu wa ta'ala accept from us. May Allah subhanahu wa ta'ala put benefit and barakah in what we do. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. السلام عليكم ورحمة الله وبركاته. Do we have time for any questions or? Yes, Sheikh. Okay, so Sheikh asked, what are the options available for people with spinal stenosis? So spinal stenosis is essentially this, right? So spinal stenosis can happen in two places. This isn't the best picture. So spinal stenosis, what it essentially means is either because of the arthritis, because of the bulging disc. Here, this is better. This is the bone, this is the disc. Spinal stenosis means either the space around the spinal cord has gotten smaller, or the space where the nerve is leaving has gotten smaller, and the nerve is being pinched. That's essentially what spinal stenosis means. It's a very broad term. Everything I talked about from pretty much here on are options for spinal stenosis. The most simple thing is physical therapy, rehab, that kind of thing. A lot of the time that's enough. If that doesn't help, this would be the next step, an epidural injection. If that doesn't help, then not this, but some of these things may be an option. And finally, if it's bad enough where the stenosis needs to be surgically cleared, then surgery is an option. But the vast majority of what we talked about would be an option for spinal stenosis. Mm-hmm. 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 Okay, so the question was, if you have arthritis and you do things like walking or activities like that, is that something advisable to do, or should you avoid it? It's definitely something that you should do. Because if you go to physical therapy and things like that, that's a lot of what they do. I mean, they don't walk per se, but they do exercises to kind of strengthen that. In fact, if you don't do anything, if you kind of stay at home all day, that's going to make it worse. But light activity like walking, swimming, if you know how to swim, a lot of my generation I know doesn't. Biking, things like that will help a lot. It can, even if it doesn't help, it can prevent it from getting worse. So it's definitely something you should keep doing. Yes, uncle. Sorry. Mm-hmm. Mm-hmm. So the question he asked is if you've been told that you need a knee replacement and you don't do it, are you going to end up in a wheelchair? You're not going to end up in a wheelchair in terms of not being able to move, right? You may end up in a wheelchair because the pain might get so bad that you're not able to stand up because of the pain. So it's not going to be because you can't move, you can't feel your legs. If that happens, it's going to be because of the pain. And sometimes we see that even like in our countries. That's why I say that if you're a candidate for it, getting a knee replacement is the best thing to do, if it's an option for you. Okay. Okay, no other questions? Okay, Assalamu alaikum wa rahmatullahi wa barakatuh.